Hello there, welcome back here on Prime Morning. It's time for us to get into another conversation, but I'm sure you did enjoy the sports update with Nathaniel Lato. Don't forget that tonight, it's all happening at Poquitos in Osu. That's where we're all having that match. And so make sure you come through. It's going to be a cracker. And I'm sure you want to come in and see which team actually becomes the winner. I don't know which team to support because it's my two favorite teams. So, yeah, I don't know which of them that I'm going to be supporting. But whichever one that comes up tops, I'll be good. All right? Yeah, so we want to see you over there. A bit later, too, we've got more conversations coming up here on the show. But on our health segment, good living segment today, we're taking a look at lupus, like Nathaniel said earlier. I don't know if you've had an experience of this. Nat has had an experience because he lost somebody very dear. But I don't know how many people that have gone through this. But it is a disease that has no cure, first of all, and that's the dangerous side of it. But there are things that make that disease what it is, and we want to get to know them even better here on the show. You can get your messages to us on our WhatsApp line. It's on your screens. On social media, it's Joy Prime TV, and it's on Facebook, Instagram, and on Twitter. We're streaming live on Facebook, so you can join in there and share your thought with us as well. And a bit later when I come back, I'll be reminding you of cues and lyrics as well. Yeah, it's happening every Sunday, 8:30 p.m. on Joy Prime TV. Don't miss it. All right. So let's get to it. This month is dedicated to lupus. And so we want to see how best we can rope in the conversation around that as well so that you get to understand what exactly happens on a day like that. My guest in the studio this morning, I've got Dr. Jifa Day. She is rheumatology consultant, Kolebu, and the senior lecturer, University of Ghana Medical School. And she's here with us this morning to help us understand this disease better. Doc, good morning. How are you doing?
I'm fine. Thank you for having us.
And thanks for making time for us this morning. We're grateful.
I'm good.
Great. And I've got another guest over here who's actually a lupus survivor. And she has a very long name. But we tried as much as possible to make it short. Even the shorter one that we have right now would keep you asking questions, but it's all good. So, my Mitchell wa Mawinyo Ofosu Mensa is here with us, and she's got some more.
Only that one for my case.
How many more left? About 3, 4?
3.
Jesus! Are you serious?
Yes. 3, so I had to.
Ma Mitchell wa Mawinyo Ofosu Mensa, aka
Mamok.
Mamok.
Yeah, because that's the initial of some of them. So
some of them even have initials. Plus 3. That's a lot. But she's a lupus survivor and she's joining us this morning. Thanks so much for making time for us this morning. We appreciate you. Now let's get to it. But like I said, you can get your messages to us. Let us know what you think about it. Maybe you've not heard about it. It's your first time. It would intrigue you what exactly this is all about. But, Doc, so lupus, well, I don't know how many people that, would understand from the doctor perspective, but make it clear. In simple terms, what are we really looking at?
Let's start from complicated to simple. So it is actually the short form of a long name, systemic lupus erythematosus. Some people call it SLE, some people call it lupus for short.
Okay.
We say it is an autoimmune disease, meaning the immune system attacks itself. The word lupus comes from a Latin word used to depict the scratch marks that a wolf makes on a person's face because of a typical rash that comes on the face of patients who have lupus called the Miller rash. Now, if I should break it down into what an autoimmune disease is, then that will come out to what lupus is. So we have diseases where the immune system, instead of fighting against foreign antigens, decides to fight against itself because it gets confused. Now, these autoimmune diseases, the immune system can attack just one particular organ. So we have that in young people who get type 1 diabetes, for example. We have people who have multiple sclerosis where the immune system is attacking just the nerves in the brain or the spinal cord. And then we have systemic type of autoimmune conditions where the immune system just goes haywire and attacks any and every organ that it decides is foreign to it. Wow. And lupus falls under one of those systemic autoimmune conditions, meaning the immune system gets confused because of various reasons, which we may talk about, and then it starts to attack itself. So it can decide one day that the skin is foreign to it, and then starts attacking it, and then presents with skin manifestations. It can decide that it's the brain that is foreign to it and starts attacking the brain. It can decide it's the kidney, the joints that is foreign to it, and so it starts attacking it. So basically, that is how it starts. And then we can talk about how it manifests.
But that's intriguing. Something that is supposed to help, fight diseases is now confused.
It's now confused. That is why Nathaniel called it the juju disease.
Yeah, because, really.
Yes, there are various mechanisms
Okay.
scientifically that makes this come about. Ideally, in most people, the immune system is supposed to wait for when cells die, the body clears it away. And when we are being formed, God is so wonderful. He designed your immune cell system in such a way that it sees every cell that you are formed out of. So that is how come it doesn't attack you.
Okay.
But for some people, this does not exactly happen. Or there are certain organs that are protected from breaking down. So for men, for example, spermatozoa forms when they are older. So the immune system doesn't get exposed to it. So if there's any problem there, it can become an autoimmune disease. The eye, the lens in the eye, for example, the body doesn't see it. So some people have an injury to the eye later on, and those cells now get exposed to the body, and then the immune system starts getting reactions to it. And once it starts getting reactions to it, anytime it sees anything that is close to that thing that it thinks is foreign, it will start attacking it. And the immune system is designed by God. The way it protects you is to fight the foreign thing until it destroys it. So once it decides the part of the body is foreign, it will attack it until it destroys it.
So it's not about whether it's weak.
No,
it's just that the thing is foreign to it.
It's actually overacting, not weak. So that is where people get confused. They think the immune system is
weak, yeah.
But it's actually overacting. But the problem is it's overacting, but it's not functioning properly. So in the end, your immune system is weakened. But if you go and try to boost the immune system, as people think, that means you are just adding more fuel to the fire. So that is not the way to approach it either.
Okay.
So we have to try and calm the immune system down when we are trying to take care of it.
I see. Very interesting. Mami, let me get to you now. So tell us a little bit about yourself, the ones you want us to know.
Okay, so my name with the long name.
Yes, a.k.a.
A.k.a. plenty name. Okay, so I'm a lupus warrior, all right. I was diagnosed way back 2015, 2014, thereabout. Then officially diagnosed in 2016.
Okay.
So I had a crisis, that's how come. And my journey started with the rash, fatigue, headaches, and all that. So I started bloating. We all thought it was just gaining weight, so I was enjoying it because I was very, very skinny. So whoever asked me, I was like, you're gaining weight? I'm like, yes, I'm gaining weight, and I like it. But later we realized that no, it wasn't an ordinary gaining weight, because after gaining weight, the bloating, then I was having swelling all over my face, leaving me with scars on my nose and the eyebrow, then this part of the face. So people see you and they're like, what's happening to you? I didn't do any at all and all that. And I'm like, I don't know what's going on. So I started visiting the hospital. Then I wasn't seeing the rheumatologist. I was seeing the normal GP and all that. So they thought it was gout. So they started treating me for gout and all that. But at a point, I broke down. For 2 months, I was admitted. I wasn't getting up from bed.
You were weak?
Yes, I couldn't walk.
I
had to be transported via ambulance to the hospital. Yes. My hair had to come off completely like Sakura.
Just like that?
It was falling off. Yes. And even up to now, it's falling off. So usually I'm in wig caps.
It's okay. You look beautiful this way.
Thank you. So, yes, I was admitted for about 2 months, just on drips and medication. Doctors didn't know what was actually going on with the system because I wasn't talking. I had mouth ulcers and all that. So I wasn't talking, I wasn't moving, I was just bedridden. After 2 months, they come in and I'm fine. So then they want to do their investigations. So they did their investigations and then they found out that I had lupus. So I was redirected to see Dr. D. And honestly speaking, I'm a very stubborn patient.
She's the doctor.
Yeah, I'm a very stubborn patient because I remember when the doctor asked me to see Dr. D. I said, oh, I'm okay. Why should I go and see another doctor? I'm comfortable here. But he insisted, Dr. Hagan, And I did see her. And when I did, I was happy I met her because she explained to me what the condition was actually about, how I had to go about managing. Earlier, you know, in our part of the world, because of our religious backgrounds and all that, people see this to be superstitious and all that. So, oh no, let's go here. Go
so
to
people actually advise that you look for spiritual help?
And I did.
Oh.
That was before I met, I was hospitalized. I did. I took in concussions and all that.
Really?
Because, yes, I had to sleep at prayer camps.
For how long?
I had to be left there to sleep at the prayer camps and all that. Oh, I can't remember, but for some weeks.
Wow.
Yes, and I missed home, but you had to go through it just so you'd be okay. You go to places, they're like, okay, this is herbal medicine, it will help you. You tell your parent, should I take this? She's like, you have to take it so you can get better, because they're also concerned. But later, when we had the education, we realized that no, that was not the right way. So quickly, I had to sit my parents down and then tell them, hey, this has happened, but let's look at the way forward. Doctor says this is what we need to do. So why won't we follow the doctor's order and then go by it? And I think when we started doing that, also with a positive mind, I'm here by God's grace.
I see. We'll get to find out how fit you are and how you're coping with all of that. But Doc, she mentioned some of the symptoms. What are some of the major ones that if ordinary me, if I start seeing them, I need to be worried?
So generally for systemic autoimmune things, I think that a few things you need to remember or take note of. Any symptom that is persisting more than 6 weeks, then we start getting suspicious. Most people, the immune system starts producing certain chemicals, we call them cytokines and so on, which eats away at their body, okay? So people lose weight, so unexplained weight loss, excessive sweating at night especially, unexplained persistent fever, you should take note. And one of the two things that is also common we see in lupus patients is joint pains, especially of the small joints of the hands and the feet, with swelling, stiffness in the morning. And then some people have the classic rash that Mami mentioned. Some people may not have it. So relying on just that may be difficult. Now we said it's a systemic autoimmune disease, meaning it can affect any other organ. And so depending on the organ that is manifesting, that is where you may have the symptom. And so that's why we call it the disease with 1,000 faces. It can present in so many varied ways. If it's attacking the joints, you present with joint pains and swellings and stiffness. For the skin, hair loss, the classic miller rash that Mami mentioned, loss of hair. Some can be scarring, it won't come back again. Sores in the mouth ulcers, it's also very common. In the heart, it can present with chest pain, difficulty in breathing. We have patients who are referred to us from the cardiothoracic unit because that is the first symptom that they have, nothing else. Fluid collects around the heart and they can't breathe. Or fluid in the lungs, sometimes it can make the lungs stiffen up. Kidney involvement, very common, which can manifest with the swelling of the face and then the feet, and you think you are gaining weight, but actually it's because the kidney is not able to flush out the proteins properly. So then that can become a problem. Some people will present with strokes. So young people who have strokes, that's usually not ordinary strokes. So you need to investigate along those lines whether this is an autoimmune condition. Some people will present with paralysis for no reason. That should be alert you as well. And sometimes it can just make the muscles break down so much with inflammation in the muscles. So like how Mami said she couldn't move, that could have been a reason why, or just because the body was so broken down. So many presentations. I've had people present with psychosis because the disease attacked the brain and they just went berserk or with a psychiatric symptom. I've had people presented because they were just sleeping for odd reasons, 24 hours, they can't get up and do anything. And so then the parents get alarmed, send them to the psychiatrist, and then that is when somebody, if you're lucky, notices that you have a classic rash or something, and then they make the diagnosis.
So you can have all these symptoms at a time, or it's...
A lot of times it is, we call it a syndrome. So you may have a mild one or you may have a severe one. And sometimes it moves through various stages.
Okay.
You start with one, then some gets added on.
Because it seems to be attacking almost every part of your body.
But it's not always a continuous thing. Some people will start with kidney and then it will settle and then that is it. Some people will just keep adding on symptoms. And so no two patients are the same. That is why it is difficult to diagnose and treat. Most places, even in advanced countries, it can take up to 4 to 5 years for people to be diagnosed because of how it presents, so varied. And so you have to really know about it, even in the medical field, have a high index of suspicion, as we say, for you to make that. So the symptoms plus additional things.
How prevalent is this in terms of the stats? Is it something okay, or it's like it's there, but we don't really know that it's there?
We would say it is there, but we don't know about it. In the past, it used to be thought that in Africa, we don't have these conditions, that it is rare. When I was going to study rheumatology, people were like, why are you going to do that specialty? We don't have these cases here. And then when I came back, they said, oh, you brought all the patients with you because now they are flooding up there.
Yeah.
But it is known that people of African descent have more severe disease. They are more likely to get kidney and brain involvement when they get this disease. And it was thought that when we leave to the other places, Europe and America, then we start getting the diseases. But no, as we started looking out for it here, we noticed the same thing. There are more cases here. When I was a student, you see one lupus case in like a month. Now every week you have 4, 5 new cases coming up. And so it's just a question of we looking out for it. We don't have prevalence studies to tell you how many are there, but we did a hospital survey looking at the percentage per the number of people who are admitted. So it's not the whole, and it was about 5.8%, which is a bit higher than other places. Yeah. And so that means it's there, but we cannot just see it. I was just reading this morning that they did a survey in the UK. We don't have a lot of these studies also outside. And 1 in 10 people have been found to have an autoimmune condition, of which lupus belongs to. And so that is a problem. That is a crisis that is looming on our hands.
Well, unfortunately, we don't even have a cure. We'll talk about that. But let me find out, Mami, so when you were told officially that, okay, this is how your lifestyle is going to be for the next whatever, you know, what was going through your mind? Were you scared? Did you at the point feel like, okay, now I have a problem I'm going to be dealing with the world?
Okay, so I think when I was told and I read about it, and I also realized that it didn't have a cure. I have a heart attack. Because I was like, what did I do? I didn't offend anybody to, you know, end up this way. But like I said, earlier I had a heart attack, but I got myself together. And then I started reading. I started joining the Lupus Foundation, both here in Ghana and then outside the country, listening to people who are also going through the same. That helped me,
What has changed in terms of your lifestyle? What are you adapting to now? How's your family taking it?
A lot has changed, but not... okay, well, a lot has
Apart
changed.
from the fact that now you have to be on a wig every time.
Oh, no, every time. Sometimes I don't mind.
Okay.
So sometimes I just let it go. People actually, why do you have... But I'm okay. So apart from that, I'm the type who likes sightseeing a lot.
Okay.
But now you don't always get to do what you want to do, because there are times you wake up from bed and then you can't do anything.
Really?
You're stuck in bed, yes. And that's an experience I don't really... because I have kids.
Your body just can't move you. You just can't go anywhere.
Yes. You'll be fine 1 minute, the next minute, it's unpredictable. So you're fine 1 minute, then I'll be sitting here with you, you're chatting all right. The next minute, I'm not. One time my mother had to experience it. She's never witnessed me going through a crisis till that day. We were just talking. I told her I was going to the washroom, I'll be back. The next minute, she hears me screaming. She comes, I'm on the floor.
And that's just...
Yes. There are times you can't even bath yourself. Somebody will have to do that for you. That's how bad it can get. That is what doctor was talking about the joint pains and all that. You can't even hold your saucepan or anything and cook. And it's a big deal. So yes, there are a lot you can't do, like on your usual day or your usual self. Now things will have to change, and then you would have to make some changes so you can feel okay. And that's what we've been doing.
How's the family taking it? Your immediate family? I mean, your kids, your...
My husband has been very supportive, yes. He knew me way back before I had lupus, and then when I had lupus, so he understands that I'm not a lazy person. Yes, because there are more times I can't do the scrubbing, I can't do a whole lot, so he understands and he helps out. And my kids are young, but they know sometimes mommy is not well.
They know that's what
they know mommy is not well sometimes. So my daughter will sometimes wake up and ask me, Mommy, today are you fine? Because yes, there are days I can't even tucking for her or buckle her shoes. So that way I had to send her to school and tell the teachers, you know, today is one of those days. They understand. So the school too has been very supportive.
Did it affect your pregnancy period at any point? Any triggers?
Okay, luckily for me, I go into remission anytime I'm pregnant, which is not so usual for lupus patients, I'm told. Normally, we are high-risk people, so pregnancy is a risky one. You can lose your life, you can lose that of the baby, you can lose both parties. So it's a high risk. So normally, you need to talk to your doctor to know when to get pregnant and when not to get pregnant. God being so good.
Yeah, I mean, it's okay. These are basic and very important things that you can do, you know, and it means that you're able to adjust yourself to make sure those things happen. I mean, at the end of the day, like Doctor said, you can't really do anything about it. But, Doc, let me know, is this genetic or you just wake up one day and then you are there?
Okay, so we say lupus is caused as a result of an interaction between the gene and then the environment. So people who have certain autoimmune diseases have certain genetic makeup. That's what makes you you. That's what makes your nose big or your family has that genetic makeup. But that gene may protect you from certain diseases, but that's that same gene that makes your immune system more likely to overreact or be hyperactive. But as I said, that is the gene that runs in the family. So that would explain why not everybody in the family has a disease, because the gene alone is not enough for you to get a disease. You have to have a trigger from the environment that comes to set the immune system off. And that's what makes it difficult for you to say, okay, this is how you're going to treat lupus, because the trigger varies. For some people, it's pregnancy. A lot of ladies come after delivery or when they get pregnant. That is when the symptoms manifest. Because we know hormonal changes, estrogen, which is what makes women women, is what triggers or makes the disease more likely to be active. Some people come because of even exposure to the sun. The sun kills cells and triggers the immune system. Some people come because of exposure to certain medications. You take antibiotics or any antihypertensive, it can give you a drug-induced type of lupus. And then some people may come because of infections, other infections that trigger it, or certain viral infections that trigger the immune system. So a lot of varied immune or environmental things that come to trigger the immune system. So it's very difficult to say this is how everybody is going to behave. The youngest self-diagnosed is like 2 years. The oldest person got it when she was 81 years old. So didn't have any trigger all the way till 81 years. And the youngest person by age 2 has had a trigger and was diagnosed.
Does it kill?
Oh, yes. Oh, yes. Lupus can kill. But we also say that lupus can be properly managed. If you do not take care of them, like I said, the immune system is designed to fight until it destroys. So if you do not calm it down, it can kill. It can kill. And
there's no cure for it. You just have to manage it.
You have to manage it. The important thing is recognizing, treating the disease. We did an audit of our patients about 10 years ago when we were starting out our rheumatology unit. Out of the lupus patients who were admitted, 48% died.
Wow.
Yeah. Because we didn't recognize, most of them were misdiagnosed as having HIV or AIDS because of how the symptoms was, not proper treatments were done. But as we've moved on, we've had more doctors being trained, people recognizing it, it keeps coming down. Our mortality now is between 15 to 20% of those who are admitted. So it's improving with care. So in other places where I went for training, I said I didn't see even one patient with lupus die whilst I was there because of the type of care and the treatment that are available. So it's a disease that can be properly managed and treated, just like any other disease.
Okay. Our time is up, but before we go, Doc, the awareness, what are we doing? Is there something special we're doing you want us to know about?
So this year, worldwide, the team is making lupus visible. We are trying to make sure people know about it. But locally, we are focusing on the hearts, for caring for hearts with lupus. We have teams every year that we follow. Because we know that with time, the heart or the cardiovascular system gets affected by lupus. And that is eventually what kills the patients. And so we want to attack or make sure we make our patients well from all angles. So we are looking at what causes heart problems, how they can make sure that the risk factors that may predispose to heart disease are recognized and treated. Cholesterol levels must be controlled. Weight gain from the drugs or the disease must be sorted out. Diet kidney involvement, all those things, we need to highlight them to make sure that patients are taking care of that as well, and not neglecting that aspect.
Okay, so if I have any of these symptoms that you mentioned, it means that I have to go to the lab and check or see a doctor?
No, we don't advise just going to the lab, because other things can give you a positive ANA test, which is what we use to diagnose lupus. We advise that if you have any of these symptoms, go and see a physician or a GP and tell him that, oh, I think I have these symptoms. I've heard about autoimmune disease. A physician will then, with addition to the symptoms, order specific labs that will then add on and then make the diagnosis. Because the treatment depends on which organ is involved and so on. Some people may have a positive test if you just go and screen without any lupus manifesting. The studies show that you can have it for about 10 years and you don't have any symptoms. So you're just going to make yourself anxious for 10 years if you just go and check randomly. But if you have a family history, if you have noticed certain suspicious symptoms, then by all means, we agree for those group of people to be screened.
Okay. Mame, before we go, what do you want to say?
I think Doc has said it all, but to add to what she said,
maybe people in your situation.
Yeah, lupus is not contagious. People shouldn't think it is. You can pass it on just like that, you know. And then also, there's life after you being diagnosed with lupus. I always say that my mantra is I live life like there's no other day. So I don't wait for someone to make me happy. I make myself happy. It can make you feel so stressed, and then a whole lot. Get you thinking of weird stuff you don't want to think of. But you should always have a positive mind. There are support groups. Please, if you haven't joined one,
look for one.
Look for one and join. There's the GLOW. You can join the GLOW. There's the TRI. You can also join that one. There are other ones too. You can join them. But get yourself involved. And let's all help create that awareness. That's what we want.
You don't even look like one that has lupus anyway. You're cheerful. You're just, living your life and all of that. You know, you don't look like one. So yeah, she's a good example for all of you out there who think that you've had lupus and so you don't really have a good life. Like you're always excited and all of that.
And if you have a great family to support you, it also helps.
Yeah.
My mom has been very, very, very supportive, and I'm thankful.
The papa no come inside.
Oh, okay, Papa, the men, they come inside.
You guys,
right?
we have issues
but the women really play the role.
I see.
Yeah, they always they won't sleep.
Yeah.
Your mom knowing you have this, she would travel all the way from wherever and come.
She's there.
She's there.
Anyway, Doc, thank you so much. Thank you so much.
Maybe if I can just sure. For those who have symptoms or searching for a support group, go on Facebook. There is the Rheumatology Initiative or the Global Lupus Outstanding Warriors that Mami mentioned. You can reach out to them for support for how to get in contact with a doctor or how to reach out to someone who might talk to you. Or you can call 054 408 9065 to find out more information as to how you can get diagnosed or reach out for help.
Awesome.
And tomorrow is Purple Day.
World Tomorrow is.
Please wear purple to support.
Okay, it's purple. The color is purple.
The color is purple for lupus.
Okay, y'all get me some purple tomorrow. I need to wear that. I need to. But I'd like to say thank you to you both for coming through this morning. We really appreciate you. We wish you the very best. You're not sick. Just enjoy your life. We like it this way. All right. So you heard Dr. Jifa Day. She's a rheumatology consultant, Kolebu, and the senior lecturer at the University of Ghana Medical School. She helped us understand what it's all about when we say lupus. And also, we had in here a survivor, Mamichewa Mawinyo Ofosumesa, a.k.a. Edina Dos Bebre +3. She also joined us this morning. And once again, thank you so much. We're grateful that you're able to join us here on the show.